Good afternoon, everyone, and a very warm welcome to today's session of SaiU Pathways, a masterclass series by Sai University, designed to help high school students to explore, future-ready disciplines and career pathways. Today's masterclass is organized by School of Allied Health Sciences at Sai University, and it is titled Heart Health Matters. We are delighted to welcome Dr. Kalimuthu, Assistant Professor at Sai University, Assistant Dean at School of Allied Health Sciences at Sai University, as today's distinguished speaker. Dr. Kalimuthu brings over a decade of rich experience in therapeutic discovery, having worked across diverse domains, including infectious diseases, inflammation, metabolic disorders, and space medicine. He holds a PhD degree and has been awarded prestigious recognitions, including Research Excellence Awards from the University of California and the University of Oxford. His research journey has begun with postdoctoral fellowships at UC Davis and Oxford University. He has collaborated with NASA's Space Technology Research Institute, where he played a key role in space medicine discovery initiatives. Dr. Kalimuthu holds a US patent, has authored several impactful publications in journals like JBC, IEEE, and Medical Virology, and continues to contribute to cutting-edge drug discovery for emerging health challenges. Please join me in warmly welcoming Dr. Kalimuthu, sir. And over to you, sir.
Thank you, Mr. Nallai, for your wonderful introduction. And then very good afternoon, students who has been participated today webinar series. Specifically, as Nallai is mentioned, this classes series specifically for allied health sciences. So what we have at Sai University, and then you can also have an understanding as a student what will be your career in the future and education, or the long term your educational career, so where that you can have an idea to direct yourself. So we will give an overview about allied health, as well as what Sai University is offering, and then also you can have an understanding as well for the career opportunity. So I can share the slide now, and then we can have a brief discussion about that. Yeah. So as Nallai is introduced, today topic is about heart health is a matter. This is a topic about more precisely about cardiovascular health related webinar series. And then as a students that we all is aware about after your high school, you may have a various concern where that you can pursue your higher education. And then also the parents also parallelly they have their own dream that our children want to study for either technology or medicine or the different career path. But as a students, you have to have as a clarity what would be my future, what would be my job career, what I want to be, whether I have flexible myself to switching different program later stage, or I might stick with only one for lifelong learning as well as my career. That is a very big question as such a young age that you are to understand. It's very too early to narrow down. So if I'm asking you, do you want to join for the technology course, do you want to join for medical, or do you want to be a lawyer? So if I'm asking the question, so something in your mind it will pop up. Okay, I have a patient to be doctor. Someone you may say, no, I want to be engineer. But the reason behind, you are not understanding the subject in detail, but rather that either your parents or the society, they have just to keep on insisting you to be in that particular career. So but as a students, this is your personal life that you want to be set in the future. You have to understand what I want to be in my life. So that is the case. So we are just bringing for you today's healthcare professionals, one of the priority and then better choice for you in your career as well as education. In this circumstances, today topic is mainly for heart health is a matter. As Nallai is mentioned, I'm representing Assistant Dean for Allied Health Sciences in Sai University. This program is in partnering with Sai University as well as Apollo Allied Health Academy, together with Apollo Hospital for the training. So today topic, heart health is a matter. This topic is mainly for so the single line, if I say, is the career that heal lives. So your career is directly connected to the society and then people, how that you are going to be address your job career is the current problem the society is facing up. And then other than that, this healthcare related courses will be offered in BSc Allied Health Sciences. And then also the course is jointly offering as a Sai University as well as Apollo Allied Health Academy partnering for where that you can have a study with the Sai University as well as medical training and everything with Apollo Hospital. Before going in detail, then I can just bring you very basic things why heart health is a matter. So why that we need to specifically think about our so heart health is a matter. So in our bodies, everything is important. Is either in your whether kidney is important, yes, of course, is important, and then your eyesight, and then everything is important. So in all organs by birth, what we have by nature given, everything is important. But as I said, heart is the primary one that you should take care of it. That will take care entire your body. So that's a logistic behind the heart health is mainly uh, just understanding the lifestyle, the global the fast growing lifestyle is, and then also for availability of food and other habit that we habituated ourselves to change the different food style. So this all is just growing concern to change whether your heart can be healthier or that you will have ended with a long life is ended with some cardiac problem. If you're looking in detail, heart cardiovascular is a number one disease worldwide, is accountable for the more number of death in worldwide. Is the rising is due to lifestyle changes, and then also for genetic comes from parents as a metabolic disease, and then also this need for skilled healthcare team members to take care for entire the patient lifestyle, which means if you are looking for the graph, 20 million is the worldwide is a death rate is account for 20 million people is not as a small number, is a very huge number. So 20 million is a death on every part of the world. And then also for it's account for 33 percentage global death. If you're looking for cardiovascular specifically in Middle East, they have over 75 percentage the risk related to cardiovascular disease. If you're looking the graph again is cardiovascular cancer, and then also respiratory disease, and then HIV like infectious disease. Cardiovascular disease is one of the predominant compared to all other diseases. So cardiovascular disease, okay, if I you can say that if I have any kidney problem or eye problem, when we go to the doctor directly they give for a medicine for treating your eye disease or kidney problem that we have. But when you go to the cardiovascular, the doctor want to take care of everything. For example, if you start to taking any medicine for cardiovascular, and then parallelly you will end it with increasing your blood sugar level. So then doctors parallelly want to address okay your heart health as well as they want to manage your diabetic as well. And then long run, and the neuropathy and then neural system started to get weakness, then doctor also the nephrologist or neurologist they want to work together with cardiologist, which means the cardiovascular if you ended with the problem which will leads to other lifestyle, other disease progression in our body. So cardiovascular is not meant to manage by only one doctor or one expertise in a healthcare sector. It will be group of doctors to work together to manage the conditions. So which means you have to understand the need of skilled healthcare team, which is highest priority to take care of one division is a hard, but you need entire healthcare professional to work together. So that's why I bring this topic today for you to why the heart health is a matter, how this will related to other healthcare related impairment, and then also how the doctors can as a teams to work together to fix this one. And then if you're not aware about some of the cardiac disease, So type of heart disease is not a only one that we say. We may be heard about some neighbors or our relatives or someone, they might have a heart attack or they may have a cardiac problem. They might gone through for emergency care, then they recover. Or some our relative or some of our neighborhood, they might gone with a stroke. So they will be in the hospital long term, and then they also go for the physical therapy, and then recover. It will take a long time. So this is what we understand in general as a heart disease, but it is not those two alone as a heart disease. If you're looking for the picture, it has a lot of things. It gives for a different disease pattern. One is a, valve disease, which is a cardiovascular. The valve, the blood valve or inside the cardiac valve will get any trouble, that will end up with the valve disease. And then also the cardiovascular valve will get some inflammation, that will, we call it as a aneurysm. And then cardiac arrhythmia, so that also another type of heart disease. And then cardiomyopathy and pericarditis, and then also heart failure. So heart failure is a final one. When this all the condition is not managed by doctors or medicine, we ended with the heart failure. So this simple understanding is a heart disease is a different conditions and a different group of disease that people going to have. So among the heart disease, if you're looking details, where I'm getting heart disease, why I'm getting heart disease. So I'm eating every day same food others, my family people are eating, and then why myself I'm entered with the heart disease. If you have the question, and then scientifically, if you want to know about that, we call it as a simply atherosclerosis. Is a terminology we call atherosclerosis. Is a, when the fatty material will continuously deposit on our inner blood vessel, that we call it a plaque building, that will deposit inside your cardiac wall or the blood vessel, that will increase the thickness of your blood vessel. So which means your blood flow will be narrowed down, then heart need to be work harder. For example, if you're going on a bicycle yourself, so you can have a happy drive yourself, but you want to take your friend as a accompanying person with you, then your effort that you need to increase yourself to be more hard worker, pushing pedal to go as a 2%. So same pattern the heart will have for the end of the day. So if you heart is a normal, will work as a normal function. But if the fatty layer deposited in blood vessel, that will narrow down in the blood flow, and then heart need to be work as effectively. So that will end up to damage all the cardiac valve and then organ, ended with the heart disease. So if the people who has a heart disease, how they are going to be treated, how who will be treated, how they will get treated. So for example, treatment care option, the first thing we need to be change is a lifestyle modification. So lifestyle modification in the sense, you may heard about this current generation, you might read something or you may heard about it. So the people keep telling for a keto diet. Sometime we say 16-hour fasting. So it means your dinner to your morning breakfast, you need to keep a long term a gap. So that is a just to give enough time to our body system to adapt and adjust to digest all the food which we have as a dinner. So keeping the long gap in between dinner and morning breakfast, and then also changing the food without having fatty items, and then also meat. So whichever is essential, so we can take it, but non-essential stuff as a lifestyle, we have to change that one. And the second thing is a medicine. Of course, even you do the lifestyle changes, and then continuous walking, running, jogging, all if you do, but still as together with the age factor, and then also for genetics all together, then sometime we ended with taking medicine. So if you started to take the medicine, then we have to follow with the doctor prescription. We have to take a medicine as long as the doctor suggesting to take over. For some rare case, the people will end it with surgery. For example, for cardiac problems, they might have a valve black somewhere, is a blood clot somewhere, and then also are ended with the valve problem. So those type of things, people ended with the surgery. But the emergency care, the people, they sometimes they people would get a stroke also. Heart and brain is connected together. It's be a stroke related disorder. Stroke is a bleeding in brain. So that is also is a emergency care. The people need to go for a hospital as emergency care. Then either they have to go for a vascular surgery or open surgery. The next thing is a cardiac rehabilitation. Okay, so I have a lifestyle, and then medicine, and then surgery or the emergency care. Now I need to go for the cardiac rehabilitation, which means the closely with the doctors and the teams like a physiotherapist and then nurses. So they have to work together to bring the life back to the normal. So that is a rehabilitation. And then key message is whether this all can be done by the doctors alone. That's a very big question. So you may ask all the time as a students, the parents all the time they ask, you want to go as a doctors. So do you think the doctor is the only person is can do everything in a hospital? Which means is the question is completely no. No doctor can. There is no doctor in the world can do everything himself or herself. Which means then who will do that? So the doctor cannot do alone, but as a team, healthcare team members they work together to make all the effort and treatment option and everything. So which means if the one doctor is available in a hospital, at least 20 other professional medical professionals they have to together as a team members to take care of each patient in the hospital. And then where the allied health play the role for this. So if I'm so the people as students as a high school, you always your priority goes to the exams preparing for the NEET. Then you have to clear for your NEET exams, then you compete for all India level, and then sometimes ended with paying for a lot of money for the other the people who did not get for the higher ranking. So then they will get a disappointment. So, oh, my patient want to be hospital as a doctor, but I'm end of the day I did not qualify whether I should change my career option to be engineering or other things, or is there any other way that still I can contribute to the healthcare sector. If you have that question is you have a great answer for that. So allied health role is a very close to the doctor. For example, allied health professional or qualified healthcare practitioner, they are distinct from medical doctor, nurses, and dentist. So they are distinct, but they make the approximately 60% of the healthcare workforce and work collaboratively with the doctor to ensure comprehensive patient care. If you are 60% in the sense is a more than 50%. So in a hospital, more than 50% the healthcare workers they are belongs to allied health professionals. So the allied health professionals who they are, what type of things they can do for the hospitals. For example, allied health people they can be audiologist or the physiotherapist or occupational therapy or a speech therapist or psychologist, the cardiovascular technologist, anesthesiologist. So, likewise, more than 13 separate divisions are available in allied health sciences. They can play the crucial role for each division. For example, cardiovascular problems, a cardiologist or cardio care division in any hospital, if you go there are primary doctor, they should be a cardiologist, and then cardiologist they can have at least 3 to 4 cardiovascular technologist. So cardiotechnologist is a allied health profession. They can be with the doctors, they can work enormously with either diagnostic and then treatment option, even for surgery or the long-term patient care. So those are all done by the allied health professionals. So why allied health is a job ready career? Okay, so if I want to select as allied health, whether I am going to have my job security or I will be ended with only in India, or is it only for example for some technology courses, if you can study sometime you might not have other options to go for a next company, or you might be ended with being in India, you might not go for abroad. So allied health whether can overcome these all the barriers. If you have that question, I can say is 100% yes, you can cross the barrier. For example, current shortage in India faces substantial gap in allied health professional with estimates of 95% deficit. So can you just closely read that line? 95% deficit in current needs. So So the current density for healthcare workers is below the WHO recommended minimum. So the World Health Organization, they have a recommendation. Each hospital, they should have a specific number of allied health professional. They can work along with the doctors to take care effective healthcare treatment option. But the current situation is not as expected level of WHO recommendation, is a 95% deficit. What is a projected demand by 2030? So you are a high school student. Sir, now I am going to be joined for the BSc undergraduates in upcoming years. So you are saying currently is a 95% deficit. I'm going to be the same situation in my future when I'm completing my degree. Can I have a similar number of job opportunity? If you have that question, yes, 100% yes, because the healthcare sector is expected to create over 6 million additional job by 2030. It's a 6 million. Just imagine 6 million people we need. So roughly 60 lakh people that we need for 2030 India healthcare workers, for potentially doubling both national and global scenario. And also if you look for the graph, highest growing in full-time employment between 2013 to 2022 is a more than 67% is a allied health professional. But if you are looking down for the medical practitioner, 41 percentage, dental practitioners is 29%, and the nursing 26, and then general practitioners are 24. But allied health alone, 67 percentage is a job readily available courses. And then this is second largest workforce for the not only in India, the worldwide. Allied health is the second largest workforce in hospitals. The fast growing allied health field is specifically for speech pathology and physiotherapy and the social workers. And also, of course, is a cardiovascular technology, dialysis technology, respiratory. They are as a dominated one. But other than that, is additional subdivision on the allied health. This all the requirement for global needs. So if you now you can have very clear idea. If I'm selecting for allied health, my job can be secure, and then the job should be high demand, and then also the job should create a, not only national and then also for global level. The next thing is what about your study and growth and future pathways? You may can have a question, for example, for if I'm selecting one technology course or I'm entered with one agriculture degree, if I have one diploma agree, so can I switch my agree to healthcare? It means it is a possible, but it's a high risk. You cannot switch to completely one direction to other direction. For example, for other technology, if you are reading, so now artificial intelligence is a highest technological advancement in computer science. From the early days, the people they started to study the Java, C++, they go that way, but they will get a job easily. But now they have to know for a large data set analysis, and then also for handling for different factors. So now artificial intelligence is playing major role in the computer science technology. Similarly, all the uh, field they're growing their own technology, but the student, if you select yourself as a technology, so then you need to be update yourself continuously. Otherwise your career will be uh, stopped, for your growth will not be as expected. So your career growth will not go along with your experience. But is it a medical, if you're selecting for allied health, can I have different option? Of course you will have a different option. I can give one by one. For example, for start working after graduation. If you get a degree in BSc Allied Health Sciences, upon completing your degree, you will get a immediately you will get a job to work in a hospital. So I don't want to be immediately to work for as a graduate. I don't want to go for immediately. So can I have a higher study? Yes, higher study you can go for MSc as a master degree in allied health profession. Then also you can go for a doctoral degree in allied health. Then whether I'm going to be ended with hospital, or do I have any other options? So you have different options. You can have a higher study option, then you can go for a hospital, then you can have a research, you can be a scientist, and then you can be a professor in colleges or universities. So you have a 360 degree you have career option. So you can have a science, you can have a professional, you can have medical as a career for our hospital. And then just I want to give one message to the parents is the parents always they look for, they are putting take caring you 100%. So they're a deep heart, they always think whether my children they're going to have a long term career growth, whether their job going to be secure. So that is a primary question the parents they have. So you need to fulfill those questions because they are taking caring for you your entire everything. So for that parent question I can answer here, this allied health sciences have a completely long-term career growth is 100% possible. Job is 100% security is available, you will get a ready job. So other technology related courses, any other things we cannot guarantee for 100%, but this one I'm sure we can guarantee you will get a job ready as well as long-term career perspective is available. And then keeping this all the background, and then what the Sai University along with Apollo Allied Health Academy, what we offer in Sai University, and then what option that you can have. Sir, that you have, you bring it today is a cardiovascular, and then heart health is a matter. Uh, I'm not fascinated about cardiovascular. Do I have any other professional medical profession that I can select for it, or whether I have option to select means that we have Sai University in partnering with the Apollo. We are offering 13 curriculum as a program. We started with a physician assistant, critical care technology, emergency medical technology, cardiovascular technology, operation theater anesthesia technology, dialysis technology, respiratory technology, and medical laboratory technology. Bachelor of optometry, and then Bachelor of physiotherapy, Bachelor of occupational therapy, and then MSc clinical embryology, and then also diploma in ART counseling. So likewise, there are 13 different program that Sai University, along with the Apollo partnership, we are offering. Currently, that we have students of current batch that they are started with the cardiovascular technology, but we have 13 different program. The student can select for their specific interest, what they want to be in healthcare for their education as well as career option. And then what would be the next call to action? So the today topic that we have discussed, heart health is a matter. So does your future can fit with allied health? Then next thing that you have to do, you have to join for a Sai University with Apollo's partnership. And then we have, if you look through the website, and then Sai University, we have website, and then we have contact details. So you can explore our university. And then university has, I can give you additional information. Our university is a liberal arts and science policies. You may not aware about what is a liberal education policy. Liberal education policy is a, you can build your career. For example, someone is you fear about maths, or I have selected for a life science as a bio as my high school, but I'm not happy with the mathematics. I might not succeed in math. So should I avoid math? Can I have other option? If you are someone who have interest like this, so we have 100%. We have option, the subject which you can select yourself. So what are the interested subjects you like to build your career, so you can select your subject. And then you can have option to interdisciplinary approach. For example, you're studying today's in allied health sciences. If you want to have, at least parallelly you want to learn for artificial intelligence as your long-term career as a parallel option, you can have an additional course you can study in artificial intelligence. Same like a technology courses we have, or other degree courses available. While you are pursuing allied health science, you can also select some of the interesting subject. For example, for artificial intelligence application in healthcare. So if you want to study something, or any technology, vaccine technology, if you want to learn any subject while you are pursuing allied health, we have option to select additional subject which you want to learn. So this is the way in abroad, like Cambridge, Oxford, Stanford. So they are offering for liberal arts and science policies. The student have option to select for other than their major. They can also select some of the courses. So same pattern Sai University we offer. That's why Sai University unique in India. And then also we have is a first international university that we offer liberal arts and science policy in located in Chennai. So and then faculty also we have wonderful faculty. They have very unique in the field of expertise. So students, your time with us in Sai University, you will have a wonderful time to learning and then career guidance for your future. So with this note, thank you so much for your time to join this webinar, and then I will be happy to answer if you have any questions or any concern related to today webinar. Thank you so much for your time.
Hello, sir. Thank you.
And thank you, Nalai.
So we have a couple of questions, sir, on the chat box. So one from Aravind.
Mhm.
So thank you, sir. Could you suggest which allied health programs are most in demand in India right now? As I have seen 10 plus courses on our website.
So I cannot. Yeah, I will guide you, but it's like the question is related to, sir. My heart is important, or my eye is important, or my lung is important. Everything is important, as I said. But it's a cardiovascular technology is the people is prioritizing to join because it's a high demand, is a global scale, and then also the cardiovascular problem is a predominant worldwide. So if you have option to select, if I'm myself, so I can select for cardiovascular technology. And then if you're interested in dialysis, if kidney related things, yeah, of course you have multiple options. But you cardiovascular, yeah, you can select for the cardiovascular technology.
Thank you, sir.
Thank you.
So, and one more question in the Q&A. So, latest one is, sir, what do you say the scope of our operation and anesthesia technology would be in the future?
Yeah. So operation anesthesia technology is a very, very unique course that is a worldwide, is not only in India. For example, if you go to the hospital, any the doctors when they go for any surgery, and then first thing they will check with anesthesiologist to check whether the patient whether they have fitness to go for the surgery. So those things anesthesiologist is a deciding factor uh, to confirm the patient whether they can undergone for the surgery or not. So every hospital in multi-specialty hospital, anesthesia is a high demand, and then also is one of the best course for the people who like to work with the hospital more on operation theater or for emergency care. Is anesthesia one of the best field? Is a high demand for job as well.
Perfect. Thank you, sir. Johnny, hope sir has answered your question. So, and one from Swati. So, what are the roles, pay scale, and growth looks like for allied health professionals in India?
In a pay scale.
Okay, sir. So, what would be the roles,
Uh-huh.
pay scale, and the growth looks like for allied health professionals?
Okay, okay. So I think the role I can explain. The role will be, for example, for if I can give example from a cardiologist. So if you go to the any multi-specialty hospital, first thing when we go to the hospital, the doctor, if you want to check with the cardiologist, any MD cardiologist or senior doctor, if you want to consult, the doctor first thing they will just ask you to take the complete your medical report. For example, you have to take a ECG, and then you want to take for MRI, CT scan, MRI scan, and then ECG, and then also echocardiogram. So there are different technical detail the doctor they have to know before they want to take for the next option, whether you as a diagnostic. So if you want to go first, what problem that someone have, the diagnostic is a primary. So those all the diagnostic work done by the allied health professional. And then also if any surgery happening or any treatment happening, so all the diagnostic and treatment related to medical care all done by the allied health professional. So doctor will heavily depend with the allied health professional for diagnostic as well as treatment management. And then for the salary, so salary is because I don't want to give a wrong information. Salaries, it depends on the hospital. For example, for if you go to the very primary hospital. If any degree, not only healthcare, if you know anything, even IT, if you're IT professional or the healthcare or any other things, or schools or education, wherever you go with degree level, at least you start with the 30,000, 30 to 40,000, so depending on the hospital or the where that you get the job opportunity. So I can say is start with the reasonable salary comparable with all other professional. This will be better. And then when your time is increasing, like you are getting the experience and being a senior, definitely your scale will go very high. And then also, if you have a master program like a BSc Allied Health as well as MSc Allied Health as a senior level cardio technologist, if you are, your pay scale will be very high.
Thank you, sir. So, and there is one question from Yoshini. Sir, I
Mhm.
learned that the doctors itself completing their course with anesthesia technology, so there is no demand for anesthesia technicians. Is it true?
No, no, no. It's a 100%. That question is, I can say no, because anesthesia is a, see, I said a 95% deficit in allied health professional all over India. That statement itself is not giving for one course demand. This is giving demand for all the allied health, all 13 different programs. So now is a anesthesia, very, very important field. Wherever you go, anesthesia, without anesthesia, doctor cannot take any decision for surgery. For example, for someone have a cardiovascular problem, parallel if they have any sugar diabetic problem, if they have any kidney stone, they want to treat. How the doctor will take a decision? Doctor cannot give a medicine directly. They go for a surgery. Anesthesiologist is a decision maker in hospital, specifically for all the surgery and operation theater. So anesthesia one of the very important allied health profession that is a highly demand, not only in India, all over the world. They have very high respect as well, because the anesthesiologist, they have a general anesthesiologist, they have a different, like for example, for you have to have some special training. Some doctors, they can put the injection in backbone, a notocard, they put injection in your backbone. That is a very skilled and then highly paid anesthesiologist all over the world, is a high demand. Is a anesthesiologist is a required field, is not a negative any impact. Yes, it is required.
Thank you, sir. So, and there is one question from our counselor. So, how about lab and practical training modules be like for the course? Do we have hospital exposure?
Yes, yeah, that is a great question, and then only so everybody can easily understand what the Sai University offering. So, as I said, is in my presentation, I keep on putting the statement Sai University in partnering with Apollo Allied Health Academy. That statement itself, it answers your question. So, how our curriculum is designed? Why Apollo is partnering with the Sai University? That is the primary things you have to understand. So other degree program, as I said, is we have different schools like a law school, technology, artificial intelligence. So we have different schools, different degree program. Those are all the program within the campus. We have a faculty and everything. So the student will be within the university sector. But it's allied health sciences. We have partnering with Apollo, which means the students for theory learning will be in Sai University. When it comes to the practical, for example, biochemistry practical, microbiology practical, so practical classes will also completed in Sai University. We have wonderful biology and biotechnology laboratory we have with all the high-end equipments we have. So for practical will be here, but medical clinical training, where that you will get a clinical training is a, you directly, we will send you to Apollo hospital. You get a training in a hospital itself. We are not going to be give a medical training in university. The training medical specifically given by Apollo hospital. So we have, that's why we have connection and partnership with Apollo. If you want to know how much time that you are going to be with Apollo, that also I can provide. First year, the entire first 2 semester, you will be with Sai University. Second year, 60% of your time with the Sai University, and 40% time you will be given training in Apollo Hospital. Third year, you are 40% in Sai University, 60% you will be in Apollo Hospital as a training. Then final year, fourth year, your completely entire fourth year will be in Apollo Hospital for extensive clinical training. So that's why this job will be this proportion will be job oriented course. It is job ready career service. So once you complete your degree, you will immediately you will get a job. So fourth year complete, you will be in a hospital for training.